Okay, so Chapter 2, Actions to Take Before Helping. So you want to perform a scene size up every single time you respond to an emergency. So that is, looking around, seeing are there any dangerous hazards present? If yes, you're going to stay away, call 911. How many people were involved? Most emergency scenes usually involve only one person, but if two or more people are present, then you can prioritize and sort through the victims. Looking at what's wrong. Are they injured or ill? Are they responsive, unresponsive, breathing normally, bleeding? Then look for clues about what might have happened to cause the injury or illness, and see if there's any bystanders available to help. So according to the American College of Emergency Physicians, you should call 911 for help if you answer yes to any of the following questions. Is the condition life-threatening? Could the condition get worse on the way to the hospital? If you move the person, will it cause further injury? Does the person need the skills or equipment of EMS? Would distance or traffic cause a delay in getting the person to the hospital? The ACEP also recommends that 911 should be called immediately for people with the following conditions so they can be brought to the hospital by ambulance to get professional medical care. Difficulty breathing or shortness of breath, chest or upper abdominal pain or pressure lasting 2 minutes or more, a fast heartbeat at rest, fainting or unresponsiveness, difficulty speaking, numbness, or weakness in any part of the body, sudden dizziness, confusion or changes in mental status, unusual behaviors or difficulty walking, sudden blindness or vision changes, bleeding from any wound that will not stop with direct pressure, broken bones visible through an open wound or a broken leg, drowning, severe burn, extremely high or low body temperatures, an allergic reaction, especially if there's difficulty breathing, unusual belly pain, poisoning or drug overdose, loss of responsiveness, spinal cord, head, or brain injury, severe headache, any sudden or severe pain, severe or persistent vomiting or diarrhea, coughing or vomiting of blood, choking, psychological, emotional, or behavioral emergencies. When calling 911, be sure to speak slowly and clearly. Be ready to give the dispatcher the following information: the person's location, the phone number from which you're calling and your name, an account of what's happened, the number of people needing help and any special conditions at the scene, a description of a person's condition and what is being done. Listen to what the dispatcher tells you to do. If necessary, write down instructions. Do not hang up until the dispatcher tells you to. Stay with the person needing help until EMS arrives. While you may not be legally required to help another person, most people believe helping others is the right thing to do. You must help when you have a legal duty to act, such as when your employment requires it, so it's a part of your job description, or there's a pre-existing relationship, such as parent-child, teacher-student, driver-passenger. Lay responders must be extremely cautious about revealing information that was learned while caring for someone. The law recognizes that people have a right to privacy. Do not discuss what you know with anyone other than those who have a medical need to know. The exception to this rule is when state laws require the reporting of certain instances, such as rape, abuse, and gunshot wounds. Good Samaritan laws provide reasonable protection against lawsuits and encourage people to help others during an emergency. Laws are different from state to state, but in general, the following conditions must be met. You're acting with good intentions. You're providing care without expectation of compensation. You're acting within the scope of your training. And you are not acting in a grossly negligent manner. Negligent actions include giving substandard care, withholding care when you have a legal duty to act, causing injury or harm, exceeding your level of training, abandoning the person. So starting care and then stopping or leaving without ensuring that a rescuer with the same or higher level of training will continue to care for the person. Always obtain consent before giving first aid. So if the person is mentally competent, of legal age, and gives permission verbally or with a nod of the head, then you can go ahead and help that person by giving them first aid. If the person refuses to help but the injury or illness is serious, tell the person of their medical condition, what you propose to do, and why first aid is necessary. If they still refuse treatment, call 911. Try to have a witness to avoid potential legal problems. Any person, adult or child, that is unresponsive with a life-threatening condition, you're going to go ahead and assume that they would accept your help and give first aid. If a child's parent or legal guardian is present or can be quickly contacted, obtain permission from a parent or legal guardian before giving first aid. A child's parent or legal guardian is not present or cannot be contacted. Assume you have permission to help their child. There's no time during an emergency to check your state's consent law. If professional medical help is needed, call 911. Do not drive the child to the hospital. Driving a child anywhere without the permission of a parent or legal guardian, even with good intentions, can potentially lead to kidnapping allegations. An adult that is mentally incompetent or unable to make rational decisions. Obtain permission from a parent or legal guardian before giving first aid. In most situations, a law enforcement officer is the only person with the authority to restrain and transport a person against that person's will. PPE, or personal protective equipment. You're going to avoid contact with blood and other bodily fluids by putting on personal protective equipment, or PPE, which includes disposable medical exam gloves. Use latex-free if possible. Nitrile gloves are recommended. Eye protection such as goggles or face shield. A mouth-to-mouth barrier device such as a face mask or face shield when giving CPR. A face covering such as a mask or face shield to prevent disease transmission. So here we just have some pictures of some gloves, mouth-to-mouth barrier device, some face masks. There we see a face mask and a face shield. So to correctly put on a face mask, you're going to start by washing your hands, then pick the mask up by the ear loops or around the head strings only, making sure not to touch the front of the mask. Use the ear loops or strings to pull the mask to your face, covering your nose and mouth. Fit the mask snugly against the side of your face and under your chin and secure the ear loops or the around the head strings, like so. A correctly fitting mask should cover your nose and mouth and be secured around your head or ears. When cleaning bodily fluids, make sure to wear PPE. Wipe up bodily fluids with paper towels. Spray or wash the area with 1 part liquid bleach and 10 parts water and let it dry. Dispose of materials in a biohazard container. If one is not available, double bag in plastic bags. When finished, wash your hands. Washing your hands. So you want to wash your hands before and after giving first aid, even if gloves are worn. Wet your hands with clean running water and apply soap. Lather by rubbing your hands together, making sure to get the backs of your hands between all fingers and under your nails. Scrub all hand surfaces for at least 20 seconds. Rinse the soap off completely with clean running water. With the water still running, dry your hands with a clean towel or paper towel. Avoid touching the water faucet by using the towel to turn off the water.